Hello, Mary. I see that the doctor put in your discharge paperwork, so I'm here just to go over them with you. Um, I do want to go over a quick little summary with you. You were admitted to the hospital after your car accident 2 days ago. During your evaluation, doctors found that you had a fractured ribs on one side and developed a small pneumothorax, which means air leaked into the space between your lung and chest wall. This air can make it harder for the lung to fully expand, causing shortness of breath or chest discomfort. The good news is that your pneumothorax was small, it has not increased in size. Your vital signs and repeat chest x-rays show that your lung is healing and you are stable to go home today. Just to talk to you a little bit about pneumothorax, that is when air escapes from the lung into the space between the lung and the chest wall. This happened after trauma, which in case was your car accident, and your broken ribs occurred, which can puncture the lung slightly. The escaped air prevents the lung from expanding fully, leading to pain or mild shortness of breath. Your pneumothorax is small and healing naturally. However, you need to avoid strenuous activity, monitor your breathing, and follow up with your doctor in 3 days, again for a chest x-ray in 1 week. If you ever feel sudden shortness of breath, chest pain, or dizziness, call 911 or go to the ER immediately. Do you have any questions so far for me?
No.
I do want to go over your discharge medications. First, you do have Norco, 10 milligrams, to take every 4 to 6 hours as needed for your pain. This will help manage your rib fracture pain. You should look out some side effects with this medication. You can see some like drowsiness, constipation, nausea, and dizziness. So you want to avoid driving or operating machinery after taking it. Drink plenty of water and eat high fiber foods to help prevent constipation. Do not take additional Tylenol with this medication to avoid liver damage. You also have metoprolol, 50 milligrams twice daily. This is to lower blood pressure and heart rate, helps prevent chest pain related to your history of coronary artery disease. With this medication, you might experience some fatigue, dizziness, or slow heartbeat. So take it with food at the same time every day. Change positions slowly to avoid dizziness. Check your pulse occasionally. If your heart rate drops below 50 or you feel lightheaded, notify your provider immediately. You also have scheduled aspirin, 81 milligrams daily. This is to help prevent blood clots due to your coronary artery disease. With this medication, some side effects are like upset stomach, easy bruising, or minor bleeding, like nosebleeds. You want to take it with food to avoid stomach irritation. Report any signs of unusual bleeding like black stool or vomiting blood. The last medication I do see here is atorvastatin, 20 milligrams daily. This is to lower cholesterol and helps prevent heart attacks and strokes. With this medication, you might see like some muscle pain, weakness, or stomach upset. With this medication, you want to take it at bedtime for best results. Report any new muscle pain or dark colored urine to your doctor. I see here that your doctor ordered an incentive spirometer to help keep your lungs expanded while your ribs heal. I want to explain to you how to use it a little bit. I do have it here for you. It should be in your room. So for this, you want to sit up straight and hold the device upright. Place a mouthpiece in your mouth and seal your lips around it. Inhale slowly and deeply to raise the piston or ball inside, and then hold your breath 3 to 5 seconds, then exhale normally. So you want to repeat 10 times every 1 or 2 hours while awake. What I normally tell my patients, if you're watching TV, try using it during every commercial break. This exercise helps prevent lung collapse and pneumonia by keeping your lungs open and clear. So this is gonna go home with you, okay? You also will want to start walking around your home as soon as you feel able. Gentle movement promotes lung expansion and helps blood clots. Avoid heavy lifting or strenuous exercise until cleared by your provider. Take deep breaths frequently throughout the day to help your lungs fully recover. Some diet recommendations: eat a balanced diet, rich in fruits, vegetables, whole grains, and lean proteins to support healing. Drink plenty of fluids to stay hydrated and prevent constipation. Avoid alcohol while on pain medication and limit foods high in sodium to support your blood pressure and heart health. Before you leave, you'll receive, it looks like you haven't received the flu and pneumonia vaccine, so we do recommend for you to receive both the flu and pneumonia vaccines. This is to protect your lungs from infections that could cause complications during recovery, especially important after a pneumothorax, since your lungs are healing. With these, you might experience like mild soreness, so you want to, move your arms. I am thinking about, if you do decide to get these vaccines today, we'll go ahead and do it on both deltoids and both arms for you. You might experience a mild soreness, redness, or slight swelling in the injection site. Do you have any allergies?
No.
Alrighty. Have you had any reactions to vaccines in the past?
Mm-mm.
Okay. Would you like to receive both the flu and the pneumonia vaccine today?
Yes, please.
All right, perfect. So let's go ahead and do that right now, and then I'll finish off your discharge summary. Oh, goodness. And I just recently asked you about your allergies. Can you verify your name and date of birth for me, please? Thank you. Okay, let me set up here real quick. So first I'm going to give you the flu vaccine here. I'm going to give it on your deltoid muscle here. So it's going to go, first we're going to find out the acromion process, and then 3 fingers down, make a V. So it's going to go right here, okay? "30 seconds. I'm going to do this for 30 seconds, so it does take a long time. But when I get 30 seconds. And we're doing 1 ml. And this will go in a sharps container. I'm going to go ahead and clean the injection side. Do this for 30 seconds. Work it. And then this will go in a sharp container. So I did give you your flu vaccine right now, and then I'm gonna go to the other arm and give you your pneumonia vaccine, okay? Let me just grab that. Same thing over here. So this is going to be your pneumonia vaccine. Clean the vial for 30 seconds. Draw up 1 ml. We have 1 ml here. Remove this. Sharps container. Get this ready. Clean the injection site again. Again, it's going to go in the deltoid muscle. Find the acromion process. Throw a finger down. Make a V. It's going to go right in the middle. One, two, three. Cap the needle. And then sharps container. So there goes your vaccines. We're going to hold you for a little bit just to make sure there's no side effects. You're doing well. In the meantime, I'll finish here your discharge summary. You do want to call your doctor if you develop a high fever, or rash, or difficulty breathing for these vaccines. Again, just call 911 or go to the ER if you experience sudden shortness of breath, any chest pain, or fainting. Follow up with your primary care provider in 3 days. And also you need to get a repeat chest x-ray within 1 week. Keep all follow-up appointments to monitor lung healing and prevent complications. I want to make sure you feel comfortable and understand everything we discussed. Do you have any questions about your medications, breathing, exercise, or follow-up care?
No.
Alrighty. I'll provide a written summary to take home so you can review it at any time, okay?
All right. Thank you.
Yeah. Thank you.